Now let's talk about the coronary circulation of the heart. Now, firstly, coronary circulation. Coronary means crown like, okay, because these blood vessels turns like a crown in coronary sulcus. That's why they are called coronary arteries, okay. And as a collectively, coronary circulation is a blood vessel systems that supply blood to the myocardium and drain deoxygenated blood from the myocardium, okay. It means it provides oxygen and recollect carbon dioxide and waste metabolic products from the myocardium. So coronary circulation has three components. Its one component is coronary arteries, its second component is cardiac veins, and its third component is cardiac sinus. Okay, now let's talk about coronary arteries. Okay, now first of all, we have two coronary arteries, okay, that originates from the aorta. From which part aorta? From the base of aorta. For example, this is aorta, okay, this is aorta, this is ascending aorta. Here we have valve, this is aortic valve, and we studied that here this part of the valve is called sinus, okay. Now from here an artery comes out, and these two arteries are called coronary arteries. So we have right coronary artery and left coronary artery. So right coronary artery originates from right aortic sinus, and left coronary artery originates from left aortic sinus. Now let's talk about right coronary artery. For example, watch it here. Some these are right coronary arteries, these are left, these are right coronary arteries, these are left coronary arteries. So now come here, let's study about the right coronary artery and its branches. This is right coronary artery, watch it here carefully, okay, zoom it. Now this is right coronary artery, originates from right aortic sinus. It comes here, okay, comes here, okay. It gives its first branch, and its first branch is called conus artery, okay. In some books its first branch is mentioned as a sinoarterial nodal branch, but the first branch here is conus artery. So now this conus artery gives blood supply to the infundibulum part of right ventricle, because we studied that this part of right ventricle was infundibulum, okay. So it gives blood supply to a part of right ventricle, specifically to the infundibulum of right ventricle. Its second branch is, it gives a branch, okay, here it gives a branch, okay, and this branch course is posterior to the right auricle, and it goes from the posterior of the right auricles and turns back to the posterior side of the right right atrium, and it supplies the SA node. This branch is called SA nodal artery, and in 60% people, this SA nodal artery originates from right coronary artery, okay. Now another part of right coronary artery is called right atrial artery. It gives some branches to the right atrium, okay. Another part or branch of the right atrium is called right ventricular branches. These are all right ventricular branches, okay. And one of the most important right ventricular branch is called acute marginal artery. So this is acute marginal artery, which runs near the inferior border of the heart, okay, and it gives blood supply to the right ventricle, okay. Another branch is called atrioventricular avinodal branch. It gives branch near the cracks. What is cracks? Listen to me carefully. This groove between two atria, this is called interatrial groove. Okay, this is called this sulcus between atria and ventricle, atrioventricular sulcus, okay, or coronary sulcus. And here in this posterior part, we had another sulcus, and this sulcus is called posterior interventricular sulcus. So the meeting point between these three sulcuses are called cracks. So this branch is originated from right coronary artery in this posterior part of the heart near the cracks. Okay, another part of right coronary artery like this, it turns back to the posterior part of the heart. This dot part, this part, it turns back to the posterior part of the heart. Okay, and here it supplies a lot of part of ventricles, specifically right ventricle, and plus posterior one third of interventricular septum. Interventricular septum means that the septum between two ventricles. Okay, and this branch is called posterior descending artery or posterior interventricular artery. So these were branches of right coronary artery. Let's talk about left coronary artery. Okay, this is left coronary artery. Left coronary artery originates from left aortic sinus. Okay, then it runs behind the pulmonary trunk, this dot like, these all dots like structures means behind the heart. So this runs behind the uh, pulmonary trunk, and when it comes out, immediately it divides into two parts. Okay, it's one part which circle the heart and go back and goes back to the posterior part of the heart. This is called circumflex artery or left circumflex coronary artery. Okay, and another part which directly comes to the anterior part of the heart or descends to the anterior part of the heart. This part is called left. This part is called left anterior descending coronary artery. It means left anterior descending means downward. Okay, now about left anterior descending coronary artery. Now it runs in this interventricular septum, but which interventricular sulcus, but which sulcus? Between anterior interventricular sulcus. Okay, it comes down, it gives a branch which is called diagonal branch. It gives a branch which is called diagonal branch. Okay, and diagonal branch uh, supplies blood to the left ventricle, to the part of left ventricle. Then it gives a branch, okay, which is called septal branch, and it supplies two-third specifically anterior two-third of interventricular septum. So posterior one-third of interventricular septum is uh, supplied by right coronary artery, and anterior two-third of interventricular septum is supplied by left coronary artery, specifically by left anterior descending artery. Okay, plus it supplies bundle branches. Got it? Now so at the end, left anterior descending coronary artery supplies left ventricle, some parts of the left ventricle, apex of the heart, a small part of right ventricle, plus septum. Got it? Now let's talk about circumflex artery or left circumflex artery, which is the part of left coronary artery. Now it runs in this sulcus, which is called coronary sulcus, and turns back to the posterior part of the heart. Okay, and in posterior part of the heart, it gives a branch which is called left marginal artery, and it supplies. This is left marginal artery. And this for example, this is circumflex artery. It turns back and it gives a branch which is called left marginal artery, which supplies left ventricle. Then it gives a branch, okay, which is called a synodal artery. So in 40% people, the synodal artery originates from a circumflex artery, but in 60% of people it originates from right uh, coronary artery. Okay, now let's talk about this point: posterior descending coronary artery. This posterior descending coronary artery in 70% of cases originates from right coronary artery, which is called a right dominance, and 10% of cases it originates from left circumflex artery, which is called left dominance, and in 20% it originates from both near the cracks or some part, and which is called co-dominance. So these were all about coronary arteries. Now we will talk about cardiac veins shortly. So now about the venous drainage of the heart. From anterior part. First of all, we have a great vessel in posterior part, a great venous-like structure in posterior part, specifically in this coronary circus. And coronary circus is the groove-like structure between atria and ventricles. Okay, and coronary circus, we know that it comes from this point, this anterior part, and turns back, and this is the back point. Okay, now here this is called coronary sinus. Okay, this part is called coronary circuit. This is the greatest vein, and this coronary sinus uh, drains into uh, the right atrium that we studied about it previously. Okay, so now a lot of veins drains into this sinus. Okay, for example, from the anterior part, we have a vein which is called greater cardiac vein. Okay, great cardiac vein, it runs in interventricular septum, in anterior interventricular septum, with left anterior descending coronary artery. But anyway, and it drains left ventricle and septum of the heart, or interventricular septum. Okay, and it goes and turns back and drains into the coronary sinus. This one branch of a venous system that drains into the drains by this coronary sinus. Okay, the next one, from this part, from anterior view, we have this vein, and this is called right marginal vein. Okay, this also drains into the sinus. Okay, plus from the posterior part, these dots are posterior part, and this is sinus. Okay, from the at the posterior part of the heart. But when we turn the heart and watch it from the posterior part, so this is the sinus, this is coronary sinus. Now three great veins drains into the coronary sinus from the posterior part. This one is called, okay, this one is called a middle cardiac vein. This one is called middle cardiac vein. Okay, and it runs into the posterior interventricular, with the posterior interventricular artery. Okay, plus here is another vein which is called small cardiac vein. Okay, and it drains right heart. Okay, and also drains by the it's also drained by the coronary sinus. Okay, and here we have another another this is small cardiac vein, this is middle cardiac vein, and this one is called posterior cardiac vein, and it also drains by this coronary sinus. And then coronary sinus uh, mm, uh, drain blood from all the heart, and it empty it into the right atrium. Okay, and we have some veins that they are directly drained and emptied into the arteries and chambers of the heart. And your anterior coronary vein, these are anterior veins, okay, anterior cardiac vein plus tibial vein, that the drain directly into the heart chambers. So this was all about the venous and arterial system of the heart, and also about the coronary sinus of the heart. Now we will talk about two important structure. I'm not going deep into this structure, but anyway, we will talk about cardiac plexus. Okay, first of all, what is cardiac plexus? Cardiac plexus is a different collections of different nerves. Okay, and these nerves innervates heart. Okay, I'll tell you about cardiac plexus step by step, don't worry. First of all, heart is innervated by sympathetic and parasympathetic nervous system. Okay, and sympathetic and parasympathetic nervous system, they control heart rate and contraction of the heart. And furthermore, we will talk about it in physiology of the heart, that which parts of the heart is exactly innervated by sympathetic and which parts is exactly innervated by parasympathetic nervous system. Okay, but anyway, plus we have some fibers, some sensory fibers, that they carry sensation from the heart to the central nervous system, and these are called visceral fibers. And we have two types of sensory system that carry sensation from the heart to the central nervous system. We will talk about all of them in physiology one by one. And these sensation are sensation of pain and chemoreceptor. Okay, and chemoreceptor regulates blood pressure and cardiac output of the heart. But anyway, now let's talk about cardiac plexus. Now, sympathetic nervous system comes from, listen me carefully, this is spinal cord. We have T1, T2, T3, T4, T5. So from T1 up to T5, these nerve fibers of sympathetic nervous system come out and innervate our heart. Now, from T1, T2, T3, sometimes from T4, some fibers go a bit to its above part. Okay, and here we know that this is a neuron. For example, this is a neuron. From previous lectures we studied all about neuron. This is a preganglionic neuron, this is another neuron, and this postganglionic neuron, and this is nuclei. Okay, nuclei is the part of the neuron where the nucleus and some structures are located. Soma is the part of the neuron where the DNA, where the endoplasmic reticulum and organelles are located. So collection of somas outside of sinus, outside of brain and spinal cord is called ganglion. Okay, now this fiber is called preganglionic fiber, and this is ganglion. This ganglion, this is called superior cervical ganglion. This is called middle cervical ganglion. This is called inferior cervical ganglion. Okay, and you're in cervical regions. Okay, now from here, post ganglionic fibers come out, and these are sympathetic nerve fiber, and all of them comes to the heart. This is one point. Okay, next, directly from the T1, T2, T3, T4, T5, some fibers come out to the heart, and these are also sympathetic nervous system. If you watch it from one side, so this is superior cervical ganglion, this is middle cervical ganglion, this is inferior. So these fibers come to the heart directly, and from T1, T2, T3, T4, T5, also fibers come to the heart. Okay, plus I'm going to make cardiac plexus. Okay, don't worry. Now, plus parasympathetic nervous system comes from, this is our brain, this is midbrain, pons, medulla, and medulla from nuclei. Here these fibers come out, this bundle of fibers are called cranial nerve. I think it's cranial nerve. it's vagus nerve, okay, a cranial nerve 10, I think. But anyway, so these parasympathetic fibers also come here, okay, and they will join to the sympathetic nervous system. Now all of them comes here, come here, okay. Now here they makes some plexus, okay, some network connection before they reach to the heart, okay. Then when they reach to the heart, they will spiral with they will go and run like spiral shape with these arteries and supplies the different parts of the heart, different arteries of the heart, a different structure like AC node, EV node of the heart. But anyway, they make two types of this plexus. One plexus is called superficial cardiac plexus. One plexus is called deep cardiac plexus. And plexus are the different fibers from sympathetic and parasympathetic nervous system. We will talk about it later on also, don't worry. So now, where is the exact location of these plexus and what are composition of these plexus? Now, superficial cardiac plexus is located beneath the aorta or anterior to the aorta, okay, to the right side of pulmonary trunk. This is superficial cardiac plexus. And deep cardiac plexus is located posterior to the aorta. When we remove aorta, posterior to the aorta, we have trachea, okay. uh, yeah, we have trachea, and here we have bifurcation of trachea. So this trachea, this bifurcation of trachea, okay, that gives right and left pulmonary bronchus. So now here and this near the bifurcation, this plexus is called deep cardiac plexus. So what are composition of cardiac plexus? Three important things we have in cardiac plexus. First, we have post ganglionic fibers of sympathetic nervous system. One. Second, we have this is the first order neuron comes out here of parasympathetic nervous system, come here to the plex. Here we have another neuron and it will synapse to the next neuron which is called postganglionic fiber. So here we have some ganglia and these are called parasympathetic ganglion. So this is second composition of cardiac plexus. And third composition of cardiac plexus is visceral fibers. These fibers that they carry sensation from the heart to the central nervous system, they also make plexus here. And plexus is simply the network of different valve-like structure or different nerves. Okay. So now, visceral fibers. We have two types of visceral fibers. Some of them carry pain sensation, okay, and fibers which carry pain sensation. They runs with sympathetic nervous system to the T1 up to T5 levels. So that's why sometime during myocardial infarction, the pain of the heart is felt in left hand and in left jaw and in left part of the body. Because of that, the sensation of left part of the body also comes to this area exactly. That's why our central nervous system cannot judge that this pain comes from the heart or either from the left hand. Okay, we'll study about in physiology, don't worry. So the pain sensation fibers, visceral fibers from pain sensation runs with sympathetic nervous system, and visceral fibers for chemoreceptor that we have a great lecture on this chemoreceptor under the title of blood pressure. They runs with parasympathetic nervous system directly to the CNS. Okay, so these were compositions of deep cardiac plexus and also the composition of superficial cardiac plexus. Sometimes someone asks you that what is exact composition of superficial cardiac plexus. So exact composition of superficial cardiac plexus is parasympathetic nervous system and sympathetic nervous system, specifically left vagus and left sympathetic trunk from superior cervical ganglion, and other parts of all innervation comes to the deep cardiac plexus. So these were all about the heart anatomy. we studied heart anatomy in full details. We did a lot about the heart. So these were all about heart anatomy and histology. If you have learned about heart anatomy and histology, please subscribe, like, and share our channel. Have a good time till next lecture.